Hello everyone, I am Dr. Vijay Varma. I am a consultant nephrologist working at SLG Hospitals. So today, let us discuss about what is a kidney biopsy. A lot of patients and their attendants have doubts regarding what a kidney biopsy is. Is kidney biopsy a big surgery? Is it a big procedure? What are the side effects? And what is the benefit that we get by doing a kidney biopsy? So, whenever someone has a kidney problem and when the kidneys are normal in size, that is when we try to do a kidney biopsy to know what is the problem that is exactly happening inside the kidney. And it also helps us to know to what extent someone has a damaged kidney. What is the percentage of the kidney damage that has happened? What kind of treatment we can give to such patients, and how is this particular patient going to perform in the near future? So all these answers we will get by doing a procedure called as kidney biopsy. Many times patients present to us with symptoms such as swelling of the feet and blood in the urine or froth in the urine. These are the patients that tend to have some form of a kidney problem happening inside. So for such patients, to know the problem and to treat it further, we definitely need to do a kidney biopsy. So what is kidney biopsy? We make the patient lie down in the prone position. That means the patient lies down on his front part of the body and we keep a pillow tucked beneath the abdomen, and under ultrasound guidance we make sure that under local anesthesia we take 2 cores from the lower pole of the kidney. The next question is, do you take the biopsy from both the kidneys? No. One sample from one kidney, whichever is a good sized and whichever is at less risk, that is where we try to take the kidney biopsy. Once we take the 2 cores of the biopsy, the 2 cores means they are as thin and as small as the length of our moustache hair. They are small bits. So these bits are sent for processing and we get information. We do what is called as a light microscopy, immunofluorescence studies, electron microscopy studies, based on which we can give you a conclusive report of what exactly the problem is within the kidney, based on which the further treatment would be decided. So what are the complications of a kidney biopsy? They can range from small bleeds. See, you need to understand that the kidney is a vascular organ. It is filled with blood. So whenever we are hitting the kidney with a small needle, there can be some amount of bleeding that can happen in the urine or around the kidney. But in majority of the cases, the bleeding tends to subside by itself. Very rare complications such as occurring in the frequency is as less as 1 in 500 or 2 in 500. Such patients, there can be uncontrolled bleeding, and in those patients we'll have to shift the patient to the ICU, maybe transfuse blood, and if the bleeding still doesn't continue, still doesn't get controlled, those are the patients in whom we try to do an angiogram for the kidneys, find out where the bleeding is and then stop the bleeding by using a coil or some kind of a gum, which is called as angioembolization. These are very rare complications. Whenever a nephrologist does a kidney biopsy, he weighs the risk versus the benefit. So what is the benefit that I am going to give a patient by doing a biopsy? What is the information that I am going to get versus how much is the risk for this particular patient? So if we find that the benefit by doing such a procedure is way higher than the risk, we definitely proceed doing a biopsy. There are certain patients wherein the creatinine, the kidney function is very low and the kidneys are borderline sized. Such patients have a little higher chances of bleeding. So leave the decision of doing a biopsy to your nephrologist, and hopefully majority of the patients, they do well after a kidney biopsy, and it is not a major surgery. There are centers which do it as a daycare. The patient gets admitted in the morning and then they are discharged late in the evening. Otherwise, majority of the patients, they are discharged the next day, and there is no morbidity associated with the procedure. That is, there is no major risk associated. So patients can go back to their work, their office within a week's time. We usually tell the patients to avoid traveling on bad roads and to lift avoid lifting weights, heavy weights for the next week or so. Otherwise, it's a small procedure. If we do it for people as young as 1 to 2 years to as old as 80 years. So it's a very safe procedure, and it is very much needed wherein the diagnosis of the kidney problem is not known. Thank you. I hope this video gives information to those patients who need it, and namaste.